The fight against cancer is always changing as we learn more about detection, prevention, and treatment. MTN Samantha Sullivan tells us about a new procedure making it easier for doctors to find lung cancer before it's too late.
Historically, lung cancer was one of those cancers that often didn't have a lot of symptoms until it was too late.
Dr. Erica Bruin says lung cancer has always been one of the harder cancers to detect. Traditionally, doctors would check for this cancer with an X-ray, which wasn't particularly effective. But thanks to new technology, the chances for early detection are much higher. It's called a low-dose CT scan. It has less radiation than your traditional CT scan, but is more precise than an X-ray.
They have to have what we call a 30-pack year history of smoking or greater, and the way that is calculated is if somebody smoked 1 pack a day for 30 years, they have a 30-pack year history. If they smoked 2 packs a day for 15 years, they have a 30-pack year history.
Colleen Badgett was one of those patients. She had smoked for 15 years, quitting about 5 years ago.
I did not have any indications. Never felt bad.
Okay, here's the very first low-dose lung CT that we had on Colleen, and you can tell that the lungs have a lot of vessels and interstitial markings, but right here is the area that was picked up as a little nodule.
That little nodule wasn't particularly concerning, but doctors did want to keep an eye on it. A year and 3 scans later, doctors noticed that little blip growing in Colleen's lung. A biopsy showed it was cancer.
Anytime they tell you the big C word, it's very scary, but I was reassured by the surgeon that, you know, we can go in and we can just take it out, cut it out, and you'll be fine.
Colleen had surgery to have the lower part of her lung removed and is now cancer-free. It's an outcome Dr. Bruin credits in large part to the early detection the low-dose CT scan offered.
You can catch it so early. It's just amazing. This disease that used to be, you know, terminal for a lot of people, we're catching it at stage 1 where they can get it out and be done with it.
In Billings, Samantha Sullivan, MTN News.
Thanks, Sammy. As many of you know, Dr. Bruin says the main cause of lung cancer is smoking and that it is never too late to quit. Tonight's Montana Snapshot takes us to the snow-capped Bridger Mountains. Take a look and enjoy. We'll be right back.